My name is Stephen Robinson. I'm a clinical oncology registrar and UHSussex medical doctoral fellow, currently undertaking a PhD under Professor Jammas at the University of Sussex. And my project is trying to develop a blood test as a liquid biopsy biomarker for brain tumours. I've completed just over 2 years with about 10 months or so remaining, and we're starting to get some really positive and interesting results. There are so many benefits to being a doctor, being a clinician, and being able to support individual patients, but to kind of enact larger change and kind of drive forwards how we manage people and patients on a kind of a larger level, we need to be getting involved in research. We need to be understanding the conditions and working out how best to manage them. So I've always kind of had that as a kind of idea in the back of my head. I studied at Brighton and Sussex Medical School, so I know the area, I know the people around, so I've always had such a good time here. And then after doing a few bits of research during my clinical training, I heard about the opportunity to do a PhD in Brighton, and I jumped at the chance. I was approached by Dr. Gilbert, who suggested that this scheme was up and running. I was put in contact with Professor Jammas, who is the scientist based at the University of Sussex, and then together we kind of developed an application based on some previous work that he had done. And with that, we then applied for the medical doctoral fellowship. Following a review by the panel, there was an interview where I had to talk through the project, what my understanding was of it, my understanding of the background, kind of what was the scientific justification, and how I thought that this project might drive forwards care for, in this case, brain tumour patients. Most of my work is related to blood samples that have already been collected, so for that I haven't had to involve patients directly. However, I know that I come in with a particular viewpoint, and that viewpoint, whilst hopefully it's appropriate and scientific, may not always hold true exactly to the priorities of those individual patients. So as part of it, I've had a variety of different interactions. I've had focus groups through national patient involvement charities. I've had individual interviews, and alongside other colleagues in the Sussex Cancer Centre, we have developed a science cafe whereby we present ongoing cancer research that is happening in Sussex to the patients and their carers and their friends and relatives to hear their feedback and kind of help make sure that we're keeping them in mind as we're driving our research forwards. My particular project is on liquid biopsies and trying to get as much information from a simple blood test as possible. And from discussing this with patients and their relatives, they are extremely happy that this research is happening. They're very keen for as much information to be gained in as less invasive way as possible. And actually, they're just very happy to be involved in research at all. Brain tumours have historically been kind of under-researched, and so they are just very keen and happy to support research into this area. We actually have been able to develop a biomarker signature based on the assessment of extracellular vesicles from a blood test. And so the next step would be to try and validate that in different cohorts to make sure that the signature and the signal that we are seeing is a truly universal feature. So I've started trying to build collaborations with colleagues nationally and internationally to gain access to additional blood samples to validate these findings. We're also going to look to see whether this signature can be used to track how patients are doing over time and in response to treatment. One benefit of that is that we might be able to detect recurrence earlier than the current standard of care, which is imaging. And we would then hopefully look to develop this into a clinically useful tool so that we can then start rolling it out to more and more centres. There are so many benefits of being able to balance a clinical and academic career. We know that there can be challenges with both of them, and so by broadening your portfolio, hopefully your drive and passion in one sphere can keep you going when there are challenges in the other one. The variety in your day-to-day is just so rewarding, and I would really hope that I can continue as a clinical academic in Sussex. Surprisingly, I've actually been better in during my PhD than I was before. So I had my son just before I went out to do PhD, and so I've really been able to limit the work that I've been doing to a more normal work pattern than I had before children, and actually that has helped kind of develop my time management and prioritization skills to be able to get what I need done during my working hours, and then I can have my non-working hours to do what I want with my family.